Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello everyone, and welcome to yet another exciting program, Your Health Matters. I'm Dr. Tasila Tembo Peters. If you recall, last week we were looking at diagnostic services in the health sector, particularly looking at laboratory services. This week we have decided to continue with that same program, this time focusing on medical imaging services. And to start the program, we will have several experts who will explain in detail about medical imaging services in the health sector. But as usual, let's start by hearing what the public feel our medical imaging services are like.
Anibwelesa kuna ziwa kuti mkumene vantu amapeza thandizo. X-ray yato ni ngono koma ili kumwana wasa ni ikulu ikoza kukopa hapa. Kwa sinigoni lako igona chabe wanu saidi.
I was so nervous because of the stories that we hear from friends. They say X-rays are bad for your health, they damage your cells, you have cancer, you have leukemia, you have this, you have that. But when I got here, I was welcomed by the doctor who saw me. I asked her if there was anything that's going to stay within my body, if there is going to be any radiation within me. She told me no, there was not going to be any radiation within me, because the X-rays are of within diagnostic value, and she explained she explains to me that it's not going to affect me in any way, because there are measures that they take for radiation protection. So that's how come I was calm, and I had my X-ray done within a short period of time.
The radiology department is one of the busiest departments in UTH. About 70% of patients that access medical services in UTH pass through radiology department. It is important, it's an important department in the sense that when clinicians or doctors are carrying out management or treatment on patients, they need information on these patients so that there is evidence in the case or a condition they are treating. There is no way we can manage, say for instance, a fracture without seeing or locating exactly where it is. Equally, there is no way we can diagnose maybe ovarian cyst without having the information about it. So it is only by ultrasound, which is provided in the radiology department UTH, that can give you this information. So as such, it is such an important department which is connected to these other departments in the hospital.
So this department is open 24 hours a day. We provide services throughout the day and throughout the night. Whatever investigative modality we have is available throughout the night. We do have doctors, radiologists on call who can respond if there's a need for the answers or the images to be given back to the doctors within the night. We tend to do special X-ray examinations, and we also do X-ray reporting, as well as CT scan reports and ultrasound scans. For plain film X-rays, we do have the results available almost immediately after they're taken, as we do with ultrasound. With CT and MRI, there's a bit of a time lag between the time the images are taken and the time the report is given.
Now, to view this picture, there is a background that is required, a certain particular uniform light that is required to view this picture. It is actually not allowed to view this picture against sunlight.
We work as hard as we can to provide the results to the patients and the doctors as fast as we can.
The ultrasound scan is very important because it helps us see which organs are diseased within the shortest period of time. And also it is less costly on the part of patients. It is very accurate because whatever is inside the body at that particular time, it's what is you are seeing on the screen. And if there's a problem on a particular organ, there and then you pick it and you make a diagnosis. So I'm just trying to get measurements for the kidneys, the right and the left. So both kidneys, the right and the left, they measure within normal limits. Our normal range is between 9 centimeters and 13. And this is 9.10 for the right kidney and 9.12 for the left. So the sizes are okay, kidneys are fine. The limitations, for instance, if you find enlarged lymph nodes in a patient, so you cannot tell the cause, whether they are just non-cancerous or there is some cancer somewhere. So for that, we would refer to CT scanning or would suggest a biopsy so that they see exactly what is causing those lymph nodes to enlarge. Basically 10 to 15 minutes on one patient, you are done. Because after the scanning, you have to sit down, do the report for the patient, give her the report, which you take back to the doctor.
It feels great because I'm able to check on what's going on inside of me.
Okay, so this is the printout. It's called the sonogram. So when it's out and you are done with everything, you sit down, do the report. This sonogram, you attach it on your report and together you give it to the patient, which you take back to the doctor.
Okay, this scan usually is done when plain film, X-ray or just ordinary ultrasound scans is not able to confirm some conditions. In patients that come with strokes, for example, we're able to diagnose strokes using this machine. In patients with tumors, whether they are in the brain or in the abdomen or in the chest, this is the machine that we use to be able to not only find those tumors, but it can also help in staging them. Staging them as in telling, are they just localized in one organ or they are spreading to nearby organs. It's quite critical in cancer management as well. Strokes and all different types of tumors. So it can be used in the brain, in the neck, in the chest, in the abdomen, and sometimes we're able to do extremities and joints as well. The use or accessibility to such services is governed by certain regulations. We know that every time a patient is exposed to radiation, there are dangers that might accrue as a result of that exposure to radiation. So we only allow patients to be exposed to radiation in cases where we know that the benefits that they will get will outweigh the risks that is involved. So you cannot just walk in here and say, I want to have a CT. We will only allow you to be exposed to a CT scan because we are sure that the benefits that you are going to accrue outweighs the risks, the potential risks that can come as a result of the exposure to the radiation. Mind you, radiation is harmful. Any level of radiation exposure is harmful. And in CT, we are using a very high dose of kV, a very high kV dose of radiation. So unless we are sure that it is going to help you, we won't be able to expose you.
It must be known that the services that we provide here are services that we need to image the human body without opening it. And therefore, there is a special type of energy that is supposed to traverse the human body so that to record the information. And this type of energy is called X-rays. And these X-rays are harmful to the body. Now, us being radiographers, we are considered to be custodian of radiation protection to ourselves, the patients, and the surrounding.
The amount of radiation that we give to our patients is not sufficient or enough to cause cancers, because the cancers that result from exposure to radiation are usually due to a large amount of radiation or a long time of exposure to radiation. With the doses or the amounts of radiation that we use in our department, they are not enough to cause the cancers in the patients that we see, because we don't expose them to that amount of radiation for a long time, as well as we don't give them a lot of radiation. So the cancers are not, we haven't had any reports of cancers being caused by the radiation that we expose our patients to here in our department.
And there are certain investigations that requires us to prepare the patient. And therefore, when these patients come to the radiology department, we give them a number of days so that they follow a certain pattern of preparation before these investigations are done. These are investigations to do with contrast aided.
The community at large should not be afraid to come and do x-rays and to do other investigations in our department, because these investigations are essential for quick, prompt and accurate diagnosis of various conditions, and can help with treating and catching conditions in the early stages before complications happen.
Well, you've heard for yourself that medical imaging services are important in establishing the cause of disease so that appropriate treatment is given to you. This has been Your Health Matters. I'm Dr. Tassila Tembo Peters. Join me again next week at the same time. From me, it's Stay Healthy.
It matters, your health matters.